All right, tomorrow is the big day, opening day at Del Mar. The horses will be running, and joining us this morning is board-certified plastic surgeon, Dr. Vince Marin, to help us put our best face forward. Thank you for being here, as always.
My pleasure.
All right, we're going to go over a couple of procedures. We're going to start with the first one, the brow lift. Talk a little bit about this, if you would.
So brow lift is something we always talk about with Botox, and it's actually, we've got a little diagram of kind of how it happens, but we're able to actually lift the brows just by doing Botox, which takes us about maybe 2-3 minutes in the office. And if you look at here, you can see these muscles are pulling up, these down, and then these at the crow's feet kind of scrunch together. With Botox, what we're able to do is take away some of these on the top, these in the center here, and it allows, just as you see on the right side, kind of going from red to green, we're looking at the brow being pulled up by the only muscles we still leave functioning out here on the outside. So we talk about it all the time. It's a simple procedure, and in a lot of patients we can actually get a real brow lifting effect just by a little injection that takes a couple minutes. So it's a great procedure, you know, getting ready for a big day or, you know, big event in your life.
And a lot of people use Botox for in other places on their face, around their eyes or wherever. Yeah, so that it can soften out in the crow's foot area, and I think we might even have another picture, but especially one of the big areas is in between the brows, that furrow. A lot of patients come in and say they kind of look angry. We can soften that. The 11s is right, yeah. Some people have a 1, 11, they even have 3 separate lines, but it's very different on patient to patient. Gotcha. Let's talk next about Voluma? Voluma. Okay. Yeah, you're right. Voluma is a new product. This is just, in looking back, going to Voluma. But Voluma is a new product that's been FDA approved for volumizing, and hence the name, that upper cheek area and giving more fullness. As you age, that cheek will kind of descend, and you can see in this patient that volume that's restored. It does make her look younger. It just kind of fills that area out. Again, it's that youthful fullness that we're going for. It's a simple procedure that's done in the office. Again, something in preparation. Takes about 10 minutes to do. We do just topical numbing. These products come with numbing medication in them, so it starts to numb that area. Very well tolerated. Adds the volume. There's no downtime. What is it? What are you putting in the cheeks? It's called hyaluronic acid, and basically the best. Well, it's just that's a chemical. Yeah, I know. Well, that's the technical name. But that being said, all it is kind of the stuff in between our cells. So holds everything together. It's a volumizer. It absorbs water, creates more fullness over a period of time of about 6 months to maybe even 9 months. That slowly goes away. Your body will dissolve it, take care of it, and all you do is go back to where you started. You don't lose anything. It doesn't cause unnecessary stretch of your tissues, so it's very well tolerated. The best thing about these products, if anyone's worried about it, there is something we can inject to make it go away. So God forbid it's not what you wanted, we can actually take it away. It takes about an hour to do. Next, Juvederm. Juvederm, another product, same family as Voluma. This one really was where it's designed is what's called the nasolabial fold. The fold right on the outside, and you look at this as an untreated area, and that's the treated side. You can see how it smooths that out, takes away that shadowing that's there, and just softens it. Again, it's a simple procedure, something you could do before a big event, but looking at that, same type of product, less cross-link, so it doesn't stay quite as long. It is a little bit softer, so it's better for the areas around the mouth and actually in the lips. It's a very great product as well. Gotcha. Next, microderm. So microdermabrasion, we actually have what's called an erbium laser. It's kind of another, technical name, but it's the light that's used. And what it does is it softens. And if you get a look at these, you can see some of the brown spots, and it's a little bit hard, but it's in the lower aspect of the eye. It takes away that outer dead skin layer, freshening that, and this is something that can be done on a graduated level. You can do it very superficially, so the downtime is overnight. You can also have it where we can be more aggressive with that, and we can end up creating, a much more improved outcome, but there is more downtime for something like opening day or, how the Pacific Coast Classic, those things coming up, and you want a quick turnaround. We can just get rid of that outer dead layer of skin, bring that fresh new layer of skin to the surface. It's a brighter, prettier appearance. Very good. Next, dermaplane. Something people don't talk about a lot. It's actually a modified scalpel blade. We've got a picture of it, and a trained technician can do this, and it's a great product for a little bit more aggressive exfoliation. It's very safe. They don't cut you. You do have to be careful, but it's a very effective way to exfoliate the skin, get rid of in a different manner that
dead outer layer of skin that doesn't look as bright, and you can take that off. I've seen it live. We do it in the office, and it makes an instant change to your skin, almost no downtime.
You got to trust your doctor, though,
you
probably,
do,
for that
absolutely.
one.
Yeah.
Lastly, let's talk about BBL.
BBL, last one we've got that's a quick turnaround, is actually called broadband light. It's a wide range of light that's gone through, and you can see it primarily treats both red and brown pigments, little age spots, sunspots that happen, some people that have rosacea. Different filters treat different things, and then that's a quick turnaround as well. This, what happens is it targets that pigment is destroyed, it comes to the surface. There is a little bit longer downtime, and we can often combine this with dermaplaning. That deeper pigment works its way up as it gets closer to the surface. Dermaplaning is a great way to get rid of it, so you're able to get rid of that pigment. Skin looks great, fresh, and you can see a big change in terms of the texture and quality of skin.
Gotcha. Dr. Marin, thank you as always. We really
pleasure.
appreciate it. If you'd like to get in touch with Dr. Vince Marin, he's located at Marin Aesthetics there in Del Mar. The phone number's up on your screen. We've also got more information on our website, fox5sandiego.com. Just click on that Scene on tab.